Student's Guide to Education as a Healthcare Professional. What is the discourse community of healthcare professionals? Before truly researching that question, I had no idea what it meant to be part of a discourse community. As it turns out, the discourse community of healthcare professionals includes all professionals that share the common goal of improving the health of patients. Health is defined by the World Health Organization as a dynamic process and a state of complete physical, mental, and social well-being. Those who share the goal of caring for these aspects of a human can be part of the healthcare professional discourse community, as long as they have the proper qualifications. Joining this community requires a lot of education, going above and beyond what you would expect. As I entered college, I began to research education within this newly defined discourse community. I had some expectations going in. For example, I knew for sure there'd be a lot of schooling, but I didn't know just how much healthcare professionals communicate for educational purposes outside of med school. Doctors never stop learning, but they use communication with each other to share ideas even after they get their licenses. I interviewed registered dietitian Catherine Parker and NICU nurse Sukhvinder Dhillon to investigate just how much a medical professional must learn in their daily practice. Types of educational communication include research articles and books, competency tests, and conferences and seminars. All of these types of educational information work to benefit the knowledge and overall practice of the medical professional. Research articles and books. This form of communication is a widespread, easily accessible form of information. It is used by practically every type of healthcare professional. In order to join this discourse community, it is pertinent that you learn how to read, understand, and apply the information in research articles. In the healthcare field, these articles are incorporated into a professional's weekly schedule. As Parker states, she reads educational texts every week in order to stay up to date. It is not enough to simply read these texts, however. As a student, you must learn how to make sense of them within your field of interest. Parker also explains she uses a mixture of books and peer-reviewed articles pertaining to nutrition science, exercise science, neuroscience, and pharmacology. Clearly, you must step out of your immediate field of practice in order to have enough information to succeed as a healthcare professional. Similarly, Dhillon reads research articles pertaining to her practice, neonatal nursing. She also reads new hospital policies to make sure she is operating within protocol when caring for a patient. She reads texts and articles every month to ensure her information is up to date. From the input of both Parker and Dhillon, it must be obvious that as a student, you must learn to read and comprehend medical texts to have success in the discourse community. Competency tests. Another means of educational communication that ensures healthcare professionals are sufficiently updated in their field is the use of a competency test. Similar to a quiz in science class, many doctors and other healthcare professionals have to take bi-monthly tests that assess their knowledge regarding both institutional policy and patient care. In order to do well in these tests, Dhillon uses online classes so that she can attain 30 credits each year. These educational credits, along with a score of 80% on the competency test, is required to maintain membership in the nursing community where Dhillon works. Other institutions require similar educational programs to ensure doctor competency. As a student, this is one thing you can count on. Those quizzes and exams never really go away. Conferences and seminars. A vital part of one's career in the healthcare field is the use of face-to-face interactions with professionals both in one's immediate community of practice and those in other related fields. Every medical professional must engage in personal contact with educators in their field in order to clarify their own questions regarding new information for their practice. Students coming from high school are typically familiar with interacting with their teachers, asking questions, and clarifying topics. These skills carry on through a career in medicine, as every medical professional is still a student in some sense. You must learn how to interact with those who have a higher standing in your community of practice, and gain information from their educational experience. This is exactly what Parker and Dhillon do in their respective practices. Parker and Dhillon both engage in face-to-face educational experiences every couple of months. Parker believes that conferences and seminars are a highly effective means of communication, as they allow for discussion, clarification, and asking questions. This is an aspect of education that students experience every day in the classroom, but is often lost once you enter the medical professional field. Conferences and meetings allow for medical professionals to bring back the vital face-to-face education. As a student, you must be prepared to always communicate with your educators, as it is a vital part of medicine that stays with you throughout your whole career. Similarly, Dylan uses hands-on education when she attends the skills lab with the nurse educator. She sees this method of education as highly useful, as she states that with a hands-on example, she can absorb information better. Both professionals interviewed use in-person educational experiences to benefit their practice. For students, it is vital to develop the skills necessary to gain knowledge from an experienced teacher in a conference or seminar setting, as well as in one-to-one interactions with the mentor. Impact of education on the practice as a whole. I'm sure every student assumes there's a lot of education involved in joining the medical professional discourse community, but the extent to which healthcare professionals incorporate educational communication in their daily routine likely goes beyond your natural assumptions. Yet, education is an immensely valuable part of every healthcare professional's practice. Parker states that this educational communication impacts her practice because she is reviewing the information she is imparting to be accurate. Without this step, she may be misinforming a patient, or even just not giving them the necessary information to receive the best possible care. She also uses the educational opportunities as a networking system in order to find other professionals that can help support clientele as well. This is also something that all medical professionals must do. They must communicate with other doctors and find professionals to build a support team for their patient. Students must learn this collaboration early on in order to experience success in this field. Dylan also experiences a positive effect of education on her practice. She states that if she is up to date, she can incorporate that information into neonatal care. As the field of medicine is constantly changing, it is important for every healthcare professional to gain the latest insight into patient care and treatment advances. For a student, you know it is never too early to begin educating yourself in the field you want to join. In order to be a successful member of the discourse community of healthcare professionals, you must first learn how to educate yourself. Beginning to read research articles, books, and attend seminars on your desired topic is the first step to becoming a lifelong member of the healthcare community. So remember, as you enter college and start pursuing a degree that will lead you to a medical career, you are committing to a lifetime of learning, growing, and developing your knowledge of medicine and science.